When we first started planning this symposium, it was before the election, last summer and last fall, and I was thinking about how we could fulfill the recommendations that came out of last year, because we had a very productive, very exciting symposium last year, and we talked about a number of things in terms of how do we move forward, how do we take action. And then the election happened, and I had assumed before that under a Clinton administration, just making a guess there, that the interoperability initiative and that agenda would continue forward, especially with the focus on children, given Hillary's strong support for children over the years. When that changed, we were a little bit stumped in terms of how do we have a conference, how do we have a symposium when we don't know what the policy agenda is going to be. We could take some guesses on what it might be, but the big open question of where are we going to go, and the concerns about what was going to happen with A87 and medical homes and technology, value-based care, all of those things that have been gaining momentum over the last decade or so, or 8 years or so. Where were we going to go? What was going to happen? How could we think about moving forward in that environment? And it took us a little while to really get our arms around it. And it occurred to us that all the more reason to bring people together in these ambiguous times, that folks needed an opportunity to talk, even more so if there was no agenda, if there was no policy agenda that was out there. I know personally, as a team, everyone I've spoken with, there's a lot of questions about where the direction of healthcare is going, where the direction of human services is going. So we said, let's just take a step forward and assume that we will be where we are on June 19th, which is where we are. And there may not be a lot of answers at this point in time, but it's a good time to really dive into this. And so really the title of this is really appropriate. It's figuring out how to take action, positive action, take movement forward in ambiguous times, and doing more of what's working and what's particularly positive about that. So there are a couple of things that I wanted to mention about last year's symposium that we are actually moving forward on. And one of those is the work with HIMSS. So when we came out of last year's symposium, HIMSS, who were here, some folks, Tom Leary and Valerie Rogers and some other folks, really had an agenda, an interoperability agenda coming out of some work that they had done with the Office of National Coordinator in Flint, Michigan, looking at how that work was happening or not happening, and how that public health disaster happened. So they approached us and said, can we do some work together? Let's look at what's happening around interoperability. What are the built systems out there, and how do we figure out how to connect systems more effectively? So over the last 6 months or so, we've been really looking at that, doing some research into that, and developing a guidance paper for actually the next administration. And we'll hear about more of that right after this session here, where that's going. And then secondly, right after the symposium, we held a small meeting with a number of people who are in this room now from Hopkins, from federal government, from some states, from other organizations, from philanthropy, and said, we really need to kick off this national collaborative, which we've been talking about for a while. And so we really took a commitment. We made a commitment to try to see if we could do that, and we're able to actually make that happen. And we'll talk about that just as well right after these opening remarks here. So we are really excited to be able to talk about the opening of the National Interoperability Collaborative. It's been a long time coming, and we've been thinking about this as an organization for about more than 10 years. And as I was reflecting on this, I actually remembered a very brief story when I was in college. Which was a number of years ago, about 40 years ago. I was working as an intern in Pierce County, which is in Washington State, right outside, right around Tacoma, and there was a task force on mental health and substance abuse, basically, at the time, made up of the state folks who provided services, the county folks who provided services. There was a big Fort Lewis military base was there. There was a whole bunch of nonprofit organizations that were there as well. And they were trying to figure out how to work more collaboratively together, interestingly enough, because they had all sorts of duplication, all sorts of gaps in their services. And they couldn't figure out how to really make progress. So as an as an intern, my boss at the time, who was the director of the agency, his name was Gene Kelly, and he invited me into this task force, and we had an opportunity. I had an opportunity to sort of work with them and kind of see what they were doing, and it became so clear, sort of coming from the outside, to see how they were stuck in their silos, and they really couldn't see beyond the services that they were delivering, and so. Coming in sort of with a clear perspective or an unbiased perspective on delivery of services, was able to actually help them think sort of laterally. What were the gaps? What were they thinking about? What were they not thinking about? And at the time, I didn't know that the term of systems was actually kind of an engineering term of how do you think above the individual systems. And so we created a little model that actually showed them how that if they decided to standardize their data elements, believe it or not, they could decide on what they were they could collect it, and then they could figure out where their gaps were and where their overlaps were and where they could invest more effectively. And it worked. They did it, and they started to really plan together, and they actually coordinated their data collection on paper. There were not too many computers at the time. And it got them started in a direction. And more than anything, it got me started really thinking about how to, what the importance of interoperability was, although we didn't have the term at the time, but how do we think about that? And it's not surprising to say that we still face many of those same challenges today. But I think we're sort of at the precipice of making the kind of changes that we can really make to move forward in a really productive fashion here. So, over the next few days, we're going to focus on a little bit of what Dean Clagg just said about, in addition to learning and discussing and hopefully getting smarter, we're going to talk about how we can actually do something to move forward. We do have a unique opportunity now to begin implementing some of the ideas and concepts we've talked about for a long time, both with the grant from Kresge Foundation, from the partnership with HIMSS, and the people in this room who I think, to a person, have a stake in making this work happen productively. I think regardless of your political persuasion, I think everyone would agree that having more and better use and access to information is a way to get us to making better decisions and focusing really on clients, a customer service, a customer-centered approach to addressing the urgent problems that we're facing here. The other important consideration as we think about addressing some of these issues really has to do with some of the potential policy changes that will happen. What happens if responsibility and authority gets pushed out to the states? What happens if block granting happens? What happens if states really have the responsibility and the authority to take responsibility for building systems that all the more need to connect and become interoperable? And we think that the opportunity and the need to figure out how to connect those systems will increase dramatically over time. I think there's no doubt about that. Even within the federal world we're living in now, if things get pushed out to the states, the need for states to be able to figure out how to become more efficient, to become more effective, and to be able to really deliver services more effectively and efficiently will only continue to grow. And so that challenge, I think, either way is dramatic. And we believe that the opportunity to really think horizontally, think laterally across systems, across silos, is something of really great importance. And so we've designed this symposium to expand learning about interoperability by including a lot of partners from various areas. So we have folks from healthcare, from public health, public safety, education, courts, national associations, professional organizations, industry, academia, philanthropy, and yes, even the international community. I'm excited about this afternoon's presentation from some of our colleagues from overseas. Maybe we have a few things to learn, or at least listen to, about how that might happen. And in fact, this year it's a little bit different. I think that we have about 2/3 of the people here are new to the symposium. Let me see your hands if you've never been to a symposium before. So that's mostly a lot of people here, which is really exciting from our perspective, to sort of broaden and expand the group of people who are thinking about this work. especially as we go forward with this effort that we'll be talking about over the next couple of days. So where are we headed over the next couple of days? Along the wall here is our journey map, and that is a visual depiction of the journey we are going to take over the next 2 days. You have a picture of that in your program. If you haven't opened up your program, in the middle of it, you'll see that. And the reason we did that was to really help both emphasize and underscore the importance of the connection and the linkages between what it is that we'll be talking about. It's not just random presentations. We've actually thought very carefully about how do we present and how do we stitch together an integrated agenda to help progressively bring everybody together. So at the end, thinking with the end in mind, which is kind of the way we approach this, we have an opportunity to define sort of version 1.0 of the National Interoperability Collaborative, which is just an amazing opportunity. It's been a long time getting here, but we're here now, and we are engaged with you, and we're inviting you into this conversation to help us as the larger community take a picture, make a picture of what that might look like as we go forward. And I think that's exciting. Yesterday, we had the opportunity to bring together some of the inaugural partners of that collaborative, and we spent a number of hours thinking about that. And there was tremendous energy in the room around just getting the idea started. And as I said, we'll talk a little bit more about that. But we have a great opportunity to do that. And so throughout the day, we have some presentations, we have some interactive discussions, we have a number of other presentations, and then opportunities to really talk about what it is that we'll be doing here. So in closing, I just want to thank you again for the opportunity to share with you. And I want to just leave you with this one last slide here, which is just a conceptual framework of how we think about change in the work that we do here. And this has been evolving over time. It's a kind of a construct to think about the work. We think about the work in three main areas: policy, structure, and practice. How do we think about those conversations? Is it a policy conversation? Is it a structural conversation? Or is it a practice conversation? And I think it helps frame up what it is we're talking about and with whom we're talking. Are we looking for outcomes? Or are we looking for innovation? Are we looking at a blend of both of those? And are we looking at it from an evolutionary, incremental perspective? Or are we looking at it from a revolutionary perspective, a really fast change? And I just offer this to you, as I said, as a conceptual frame to think about it in terms of the conversations we're going to be having over the next 2 days. And how do we frame those conversations? So we make a policy decision that's going to affect frontline staff. It's going to affect the structural nature of what it is that we do. And so these things are tied together. If you're having a policy conversation and somebody's thinking about practice, those things have to be aligned and harmonized in order to make that happen.